Cancer. It's the diagnosis everyone is scared of receiving. We know that if caught early enough, we can beat it or live far longer than previous generations did. But what if we could get to cancer before it gets to us? It might sound too good to be true, but we can now do just that. And it's all thanks to genetic testing.
So genetic testing gives us the background of why diseases may happen. It is an emerging part of science that is blossoming and giving us many, many options. So in breast disease, we're looking at what genes might be contributing to cancers that we can detect early, prevent, and have treatments for. As an example, here in New Mexico, we have a population that have a Spanish heritage. That Spanish heritage has a very high preponderance towards the genes of the Sephardic Jews. And the conquistadors immigrated to the New World and to Mexico and New Mexico. We're able to track those genes as the conquistadors traveled through New Mexico up into Colorado and then back down to the other corner of Colorado. These genes are very high rate of having cancer associated with them, BRCA1 and BRCA2. By testing women, we are able to identify those families, and rather than having a very, very high chance of getting cancer and dying of cancer, we can return to them normal life and normal living.
For families who are being peppered with one cancer diagnosis after another, this is extraordinary news. Finding out if someone is genetically predisposed to a certain type of cancer allows the doctor and patient to work together in finding ways to prevent the disease.
Genetic testing will give us routes for treating and perhaps preventing cancer. There is work being done that may be involved with vaccines or by detecting genes before they have caused a cancer. We're also doing genetic testing on the cancers themselves and customizing treatment for the cancer care, something that's never been done before.
I believe that the genetic testing is very important. When I received my diagnosis, my OBGYN gave me the paperwork. She said, "I don't really know what this means. I'm going to refer you to one of these doctors." And that's where I selected Dr. Smith and went to see her. I have seen in the last 4 years a lot of attention, a lot of emphasis have been placed on the importance of getting tested. I have had nieces that as a result of my aunt and myself getting tested have been tested themselves. I'm grateful that based on my family history with cancer, I'm able to have the testing done. My own daughter just turned 22. I want her to be tested so that she knows what her risk is, and it enables us to be proactive rather than reactive with cancer. I've been monitored by my doctor ever since.
Cancer screening tests are very important for finding diseases before they have gone into the rest of the body. So if people undergo regular colonoscopy, the chance of dying of colon cancer is almost zero. In breast disease, we recommend mammography starting at 40. We're finding that the death rate from breast cancer occurrence is going down in age. Unfortunately, some of the guidelines are saying we should not start mammography until older age. We really believe that mammography catches cancers 5 to 10 years before we would find them with any other method. The other thing we found is that most women who get breast cancer do not have a family history of breast cancer. The detection we get from mammography and from examination of the breast is huge.
Since 1984, Dr. Linda Ann Smith has been solely dedicated to the treatment of breast disease. Here at her practice in Albuquerque, New Mexico, Dr. Smith performs all of the standard advanced procedures, including genetic testing for the breast cancer genes.
So the BRCA1 gene is one of the genes that's very common in New Mexico. It's also common amongst the Jews from Eastern Europe and Israel. That particular gene has several varieties, but of that variety, one type has a very high risk of breast cancer, as high as 80%. As soon as we know that the family has that kind of risk, we, number one, try to counsel the whole family, get tested who we can. If we know someone has a high risk of that, what we would do would be do MRI starting at age 25, mammography at age 30, and we would normally biopsy anything that looks abnormal. Then we talk about prophylactic surgery when they hit 40-ish or when we start seeing signs of something possibly turning cancer. The other problem is that they have a high risk of ovarian cancer. So we partner up with the ovarian doctor specialists in genetics to try to figure out what surveillance should be done and when preventative surgery on the ovaries should be done, usually 40 to 45.
Dr. Smith's highly qualified staff will help to ensure a comfortable and pleasant experience before, during, and after treatment.
Dr. Smith has been an amazing doctor for me. She's been patient with my own hesitation, and she's monitored me. Every 6 months I alternate ultrasounds and MRIs, and she monitors me, lets me know, we're here to move when we have to move, if we have to move. And I feel very confident in the care that I'm receiving with her. I know she has a lot of history and experience treating BRCA patients. I'm grateful that I have Dr. Smith to be my doctor and monitor me and guide me through this scary predisposition that I have for cancer.
I think genetic testing is being opened up to all age groups. We now have an ability to test people outside of insurance at a very low cost, so it's opened it up to our older patients or patients who wouldn't meet the criteria but want to know. We're able to add information to many of the tests that are very helpful for prevention, be it for breast cancer, thyroid disease, colon cancer, uterine and ovarian cancer, melanoma, and many others that are blossoming as the technology has blossomed to give us the opportunity for that research.